New advances in HIV treatment have provoked celebrations, but also debates at the 20th International AIDS Conference held this year in Melbourne, Australia. Medical treatment of the virus is big business, with multi-billion-dollar annual revenues. Dr. Luis Lores of the United Nations AIDS Agency says those advances include better treatment options, but also pill-based prevention.
We now know that treatment, in addition to saving lives, may become a major tool in terms of prevent the expansion of the AIDS epidemic. No question that expansion of treatment, mainly if we start early, you play a major role in the journey towards the end of the epidemic.
Dr. Lores is referring to one of the more exciting new advances, pre-exposure prophylaxis, or PrEP. Pharmaceutical company Gilead makes Truvada, a pill that has been shown to have a success rate of up to 75% in preventing HIV transmission, according to a recent study published in the medical journal Lancet. Gilead's James Rooney explains the new strategy of using PrEP in the war against AIDS.
It's a strategy that uses HIV drugs that are oftentimes used for treatment, but in this case, the drugs are actually given to individuals who are at high risk for becoming infected.
But AIDS activist Gus Cairns says it may be too soon to celebrate. Also, he notes many people may not want to take an AIDS drug when they don't have AIDS and will prefer to stick to condoms.
It's very, very early days. PrEP is going to arrive incrementally, very slowly. It's not going to be a sudden revolution. And the chances are still that there may be people who simply can't use it, for whom it's just not the answer.
South Africa-based researcher Brian Kanyamba says the region hit hardest by AIDS, sub-Saharan Africa, needs to have a choice about PrEP. He notes that studies show that condom use has significantly decreased in his country. South Africa has the world's highest incidence of HIV, with more than 6 million people infected.
Let it be available. Let the discussion start right now.
This year's gathering has featured thousands of hours of events on every aspect of this mystifying virus, from the science to the social impact. But the one thing all of these activists want is the one thing scientists say they're getting closer and closer to: a cure. Anita Powell, VOA News, Melbourne, Australia.